afternoon, everyone, and welcome back to the Brainy Boomer Lecture Series. We're so very happy that you've all joined us today. We would like to begin by acknowledging that the McGill University Research Center for Studies in Aging is located and our work is done on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters on which we gather today. Tiohtià:ke, commonly known as Montreal, is historically known as a gathering place for many Indigenous peoples. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connection with the past, present, and future and our ongoing relationships with Indigenous and other peoples we serve who live within the Montreal community. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of their needs, to enhance the positive image of the aging process by addressing stereotypes and myths about aging, and finally, the dissemination of research on aging. Our presenters for today are Marie-Christine and Sarah from Alzheimer Society of Montreal. Marie-Christine is the Director of Programs and Services at Alzheimer Society of Montreal and has next to 20 years of experience working with seniors, including more than a decade with a clientele living with neurocognitive disorders, caregivers, and professionals in the health and social services networks. She graduated in gerontology and now focuses on the issues related to aging from a multidisciplinary perspective, combining social work, psychology, and biology. This perspective gives her a global vision of the needs of the clientele she supports and offers a wide variety of solutions and innovations. Since she arrived in 2016 at the Alzheimer Society of Montreal, she has been a trainer, conference speaker, and coordinator of clinical services. As director, she now ensures that the needs of the communities are aligned with the provided service. From her rich and varied experience in hospitals, CHLDS, CLSCs, day centers, and community organizations, Marie-Christine now supports a team of 40 people in operationalizing ongoing projects based on person-centered approach. Sarah is the communications and PR manager and project manager for My Cognitive Health at the Alzheimer Society of Montreal. With a bachelor's degree in political science, a specialty in international relations, and studies in public relations, she is known for her analytical skills and her ability to demystify complex concepts and communicate them to the public. Passionate about communications and human relations, she has many partnership development accomplishments in the field of prevention and health promotion. At the Alzheimer Society of Montreal since March 2020, she has been an awareness agent and head of the My Cognitive Health project for the development, promotion, and awareness of the project among health professionals and the public. As communications and public relations manager, she now oversees the writing, development, and execution of the Society's internal and external communications activities in collaboration with the communications team. Before continuing, we would like to remind you to please mute your microphone on Zoom, and that if you have any questions, you could either write them down in the chat box on Zoom, or you can unmute yourself at the end of the conference and ask them directly. And now I'd like to invite Marie-Christine and Sarah to start their presentation.
Thank you so much.
Thank you, Caitlin. Thank you also to the McGill Studies on Aging for having us today. My Cognitive Health is a very nice project that we are pleased to talk about with you today, especially with my colleague Sarah, who has been in charge of implementing and developing tools on that specific project. So it's a pleasure to be here with you today. There will be, of course, a period of questions at the end, so don't hesitate to note them down, and it will be our pleasure to answer all of them as we can. So understanding Alzheimer's disease and promoting my cognitive health is the topic for today, as you all know. And the objective of the conference is really to allow you to know more about neurocognitive disorders, of course, by demystifying their characteristics and also recognizing the warning signs, which for us is one of the is really important before getting to the second part, where we will provide you with tools to promote and maintain your cognitive health, which I'm sure you are eager to learn about.
So about my cognitive health. So sorry, I'm having a so it was first funded by Quebec Ami Des Ainés for the past 2 years. The project was born out of a concern to raise awareness among seniors to take concrete action to promote their cognitive health, to allow people affected by neurocognitive disorder to maintain their skill as long as possible, and to promote health and improve the quality of life of seniors. So we had like 3 main objectives for the project. It was to, and it still is, to equip seniors who have recently been diagnosed with a neurocognitive disorder to take some action. The second one is to act as a liaison between people with the disease and the services of the Alzheimer Society of Montreal in order to accompany them throughout their journey. And the third one, which we will talk about today, is to raise awareness by facilitating access to information. So why prevention is so important? So what you have to know is dementia is a major cause of disability and dependency among older adults worldwide. We know that it affects memory, cognitive abilities, and behavior, which impacts daily activity. The impact of the dementia is not only significant in financial term, but also represents substantial human cost to countries, societies, family, and individual. So we know that dementia is underdiagnosed worldwide, and if a diagnosis is made, it is typically a relatively late stage in the disease. So there's also a lot of lack of awareness and understanding of dementia, and which is often to blame, and it results in stigmatization and barriers to diagnosis and care. So these are the main reasons why prevention is important, and we'll get through them a lot more in the presentation.
Yes, so about Alzheimer's disease, aging is a natural process in our lives, in all our lives. I would say it's a privilege also, but there's differences between normal aging and developing a neurocognitive disorder. As we get older, we experience gradual changes in our brains and bodies. Some of these changes affects our physical or mental abilities and may increase our risk of developing a disease. Each one of us experiences aging differently. The extent of how we experience changes due to aging and the point in our lives where they start becoming more noticeable varies from a person to another. According to the World Health Organization, the WHO, each person should have the ability to live a long and healthy life. This is considered healthy aging. As we grow older, it's natural to feel concerned about changes in our mental abilities. We want to carry out our daily routine, be self-sufficient, and relive or remember the most treasured moments in our lives without having to worry about our memory or in particular neurocognitive disorder. So as you can see on the presentation, it can be normal to not remember a person's names momentarily or mix up some names. I remember my grandmother, she was trying to remember my name. She called me my mother's name, my aunt's name, and then came out my name. So this is part of normal aging. Not recognizing a family member or forgetting their names, not just momentarily, this is a warning sign that we'll see this a little later of a neurocognitive disorder. So there are some differences that you can see now on the screen, but for us, it's really important to say that some of the changes changes are normal and some of them aren't. So that's for this slide. And most of us will continue to have strong memories as we age. So our ability to remember will not decline rapidly or substantively. Sorry, you can see Sarah and I, we are francophones, but I think our English will do for today. Don't hesitate if you have any questions to write them on the chat or if you don't understand what we're trying to say. Okay, so neurocognitive disorder, as you can see, maybe you've heard or maybe I even said it, we usually use the term dementia, but I will make an effort today to talk about neurocognitive disorders instead. Especially in French, I would say the term dementia has very negative connotations. So it sounds like demented or demon, and we feel it plays a role in the stigmatization of those who are affected. That said, cognitive disorders are not a disease, but rather a generic term that encompasses a series of symptoms. I would say think of them, the term, as an umbrella, and each branch as a type of neurocognitive disorder. I've often been asked in different conferences, what's the difference between dementia and Alzheimer's disease? Well, in fact, Alzheimer's disease is a form of dementia, or as I would say, a neurocognitive disorder. Worldwide, more than 50 million people live with a neurocognitive disorder as we speak, which is a progressive degenerative brain syndrome that affects, of course, memory, but also behavior and emotion. According to Alzheimer's Disease International in 2018, every 3 seconds, someone in the world develops a neurocognitive disorder, which is why it's really important to discuss today. So next slide, please, Sarah. Thank you. So as I mentioned, imagine neurocognitive disorder as an umbrella. Alzheimer's disease we say about 64% of all types of dementia. There is vascular dementia, which is caused by problems in the blood vessels that feed the brain and can be caused by a stroke or caused by a small vessels disease. There's mixed dementia, which is usually a combination of both Alzheimer's disease and vascular dementia. There is also frontotemporal dementia, which you may have heard about, or FTD, which involves extreme changes in behavior and personality, like, let's say, inappropriate action, loss of empathy, or other interpersonal skills, inhibition. Research suggests that it makes up to 5 to 10% of all cases of all diagnosis of neurocognitive disorder, and most frequently affects people that age 50 to 60 years old. We also, there is also Lewy body dementia, which can occur with Alzheimer's disease or Parkinson disease. Statistics show that it represents 10 to 15% of all neurocognitive disorder, and that is more common to for men to have this type of disease. There's also Kruszev-Jacob disease, which is very rare, and it rapidly developed and it's another type of protein. But I won't go into all the details because today, as you know, we represent the Alzheimer Society of Montreal. So we're talking more about Alzheimer's disease. And I know that Brainy Boomers, you have a lot of experts that come to you and share their expertise. So we won't go into all the details of neurocognitive disorder. But Alzheimer's disease is, as you probably already know, is a progressively degenerative and fatal condition that causes the loss of cell connection in the brain and eventually the death of cell brain. And I will say this again, it is not part of normal aging. Alzheimer's disease affects different parts of the brain, and because each part of the brain have different functions, Alzheimer's disease affects each person differently. However, memory is always one of the symptoms in all the cases. I'm going to show you quickly the physical differences in the human brain. So what I would like you to notice is the enlargement of cerebral ventricles. As you can see, they're pointed out. Well, you don't see what I'm pointing, but the difference between the brain on the left and the brain on the right is the enlargement of ventricles and also the hippocampus. So you can see that the brain is what I would say shrinking. So there are also physical differences in the brains. Okay, where are we now? Just so I know, Alzheimer's in numbers. So I mentioned a number quickly before, but more than 432,000 Canadians age over 65 are actually right now living with a neurocognitive disorder. 2/3 of those persons are women, and one of the most risk factor is aging. So every 5 years between 65 and 85, the risk of getting a diagnosis doubles just because of age, of getting older. So there are different ways of talking about stages in Alzheimer's disease. There are different scales, but at the Alzheimer Society, we're really just talking about early, middle, and late stage, just because we're not doing some diagnosis and we're not assessing the stages, but it gives us a good idea of what's going on in the person's life throughout the stages. So the early stage is really about mild impairment. Common symptoms include forgetfulness, communication difficulties, changes in mood and behavior. People in this stage retain many of their capabilities and require minimal assistance. They may also have insights into their changes abilities, and therefore they can inform others of their experiences of living with the disease and help to plan and direct for their future. At the middle stage, we're talking about greater decline in the person's cognitive and functional abilities, like memory and other cognitive abilities will continue to deteriorate, although people at this stage may still have some awareness of their conditions. Assistance with many daily tasks may become more necessary. At the late stage, the person eventually becomes unable to communicate verbally or look after themselves. Care is usually required 24 hours a day. At this stage, the goal of care or caring is to continue to support the person to ensure the highest quality of life possible. At the end of life, we're talking more about comfort. Comfort measures become the focus. Physical as well as emotional or spiritual needs must be carefully considered and attended to. For example, providing palliative care that focuses on quality of life and comfort. Warning signs. So there are some warning signs that we want to point out today. There are 10 of them. The one that we know usually is the memory loss. So for someone with Alzheimer's disease, it is not just a question of occasionally forgetting where their keys are. It is always forgetting where their keys are or not remembering what keys are used for. Everyday tasks may become increasingly difficult. Someone who, for example, baked a certain cake perhaps 100 times in her life must resort to looking up the recipe, and even then may not be able to follow the instructions. As a result, she may say, I don't feel like baking today, or become more aggressive, or say something like, why do I always do the baking? Don't I deserve a break? That's just an example. The person with Alzheimer's disease loses memory, not intelligence. This is very important. The person may have difficulty finding the correct word, but may use alternatives. For example, if we know we're forgetting the dog's name, instead of trying to call the dog by the name, we can say the dog. This is ways to don't put the person in a failure mode. Eventually, both speech and comprehension will be affected, though, and communication becomes a serious issue as the disease progresses. The person may become lost in their own street or in their own home when we're talking about disorientation. They may fail to recognize familiar landmarks or points of reference. Poor judgment or loss of judgment. So a person with AD may have decreased judgment, for example, not recognizing a medical problem that needs attention or wearing a heavy jacket on a hot day. Abstract thinking. So someone with Alzheimer's disease may have significant difficulties performing tasks such as balancing a checkbook. Person may not recognize what numbers in a checkbook mean. They may fail to understand the value of money, paying everything with a credit card or with a $20 bill, no matter the amount of the check, for example. Anyone can temporarily misplace their wallet or keys. A person with Alzheimer's disease may put things in inappropriate places, an iron in the freezer or a watch in the sugar bowl or things like that. They may also begin hiding things or hoarding. Men hide their wallets, women their handbag or their purses. Those are warning signs. Changes in mood and behavior can occur also. Someone with Alzheimer can exhibit varied mood swings, and they go quickly and fast. So from calm to tears to anger for no apparent reason. It will be important when this happens to respond to the emotion behind these changes. Finally, there are changes in personality. So someone may become confused, suspicious, or withdraw. Changes may also include apathy, fearfulness, or acting out of character. Proper older lady suddenly swearing like a sailor, for example. And then there's also loss of initiative or apathy. So someone may become very passive and requires cues or prompting to become involved. The first response to a question by someone with Alzheimer's disease is frequently no. So those are the warning signs. Just be aware of yourself, but also of your family or your friends, and really try to talk about what you are noticing. I think it's really important.
Thank you so much for this, Marie-Christine. So now we'll get to the second part of the presentation. So can we prevent Alzheimer's disease? First, there is no specific method, treatment, or substance that is proven to prevent dementia. The good news is that we know that there are things you can do to reduce your risk of dementia, thanks to many studies being done on risk and prevention. As many of the risk factors can affect your chances of getting dementia, involve your physical and mental health, the best way to reduce your risk is to lead a healthy, balanced lifestyle and takes care of both your body and your brain. So what are risk factors? Risk factors are aspects of your lifestyle, environment, genetic background that increase the likelihood of getting a disease. You must know that risk factors on their own are not cause of a disease. Rather, risk factors represent an increased chance, but not a certainty that dementia will develop. Similarly, having little or no exposure to risk factor does not necessarily protect a person from developing Alzheimer's or neurocognitive disorders. Some risk factors are modifiable, meaning that they can be changed. It has been estimated that around 40% of dementia cases may be a result of 12 key modifiable risk factors. So we'll get into those. I'll present you some of them, but just so you know, if you want to look it up, there's a lot more. So non-modifiable risk factors. We have age. Dementia is not a normal part of aging. However, age is the strongest known risk factor for dementia. The older you become, the higher the risk. Like Marie-Christine said in the beginning, 1 in 20 Canadian over 65 has Alzheimer's disease. After 65, the risk of Alzheimer's disease double approximately every 5 years. So that's a lot. The second non-modifiable risk factor is sex. We know that women have a higher risk of developing Alzheimer's disease than men. While the reason for this are still unclear, some of the potential contributors include women living longer on average than men and change in estrogen level over a woman's lifetime. The third one is genetic. We don't yet fully understand the role of genes in the development of dementia. We do know that most cases of Alzheimer's disease are sporadic, meaning that they do not run in families. For the modifiable risk factors, which we will focus more on, there's lack of physical activity. Physical inactivity in later life increases the risk of developing dementia. A poor diet, an unhealthy diet high in saturated fat, sugar, and salt can increase the risk of developing many illnesses, including dementia and cardiovascular disease. Low level of cognitive engagement. Cognitive engagement is thought to support the development of cognitive reserve. This is the idea that people who actively use their brain throughout their lives may be more protected against brain cell damage caused by neurocognitive disorder. We also have depression. People who experience depression in mid or later life have a higher risk of developing neurocognitive disorder. However, the relationship between depression and dementia is still unclear. And the last one is social isolation. Social isolation can increase the risk of hypertension, coronary heart disease, depression, and unfortunately, dementia. So, how to act on modifiable risk factors. So here are a few brain healthy tips to reduce your risk of neurocognitive disorder. So adopt a healthy adopt healthy eating habits. So not only do healthy eating habits improve your overall health, but they may help maintain brain function and slow memory decline in the long run. You may ask, where should I start? We suggest that you eat a variety of food, especially fruit, vegetable, and whole grain products. The more colors there are in your plate, the better. You can also use Canada's Foods Guide to adopt a healthy diet. Of course, unless your doctor has recommended a particular diet for medical reasons, such as diabetes. Oh, I'm so sorry for this word.
Diabetes.
Diabetes, thank you so much. And we suggest that you limit your intake of salt, alcohol, and caffeine. So really no need to become a nutritionist. You just have to make a few changes to your menu. So we'll present you one of our little video that can provide you more information. So thank you. So the second healthy habit is to reduce your stress. So over time, stress can cause a chemical reaction that damages the brain and other cells in the body. By reducing your stress, you improve your brain health. Regular exercise is an effective tool in reducing stress and improving moods. So maybe take time for yourself, exercise, relax, have fun, enjoy your hobbies, and socialize. They all are a good way to improve your health and well-being. So the third tip is to be physically active. People who exercise regularly are less likely to have heart disease, diabetes, or stroke, all three of which are associated with an elevated risk of developing a neurocognitive disorder. Physical activity promotes blood flow to the brain, which nourishes cells and provide them with oxygen while helping to form new cells. In addition, regular exercise helps reduce stress and improve mood. So why not try it? The fourth tip is to maintain an active social life. Maintaining social connection helps keep your brain in shape. It's been shown that the brain of people who have regular social interaction function better than the brains of those who don't. Social interaction appears to have a protective effect that help reduce the risk of developing a neurocognitive disorders. In other words, maintaining social connection helps keep your brain in shape. So an interesting fact, the impact of loneliness on a person's health is equivalent to smoking 15 cigarettes per day. Just so you know, good news, chatting with a friend, it's much more easier than quitting smoking. The fifth tip is to practice a good hygiene. I'm sorry, I'm just gonna stop this one. Sleep helps to strengthen memory and eliminates toxins that play a role in some neurocognitive disorders. Lack of sleep can affect memory, mood, and functional abilities. I'm just gonna play another video that can give you a lot more information. So here are some easy tips to promote good sleep. So as you've seen in the video, you can set up an evening routine to prepare your brain for the upcoming rest period. Avoid using devices at least 30 minutes before going to bed. We suggest that you avoid coffee in the afternoon, take a hot bath, and exercise throughout the day. We also encourage you to not exercise right before you go to sleep. And the sixth and last tip is cognitive stimulation. I'm sorry, I went too fast. Cognitive stimulation, also known as mental activity, helps the brain compensate for cognitive decline. Stimulating our brain increases our chance of delaying the onset of symptoms of neurocognitive disorders. Using your cognitive abilities to helps to maintain a good quality of life. Just so you know, activities that engage your brain don't have to be difficult to be beneficial for your cognitive health. By choosing activities based on your interests, you'll be more motivated to incorporate them in your routine and enjoy them. We suggest that you engage in games such as crosswords, puzzle, and chess, reading, practice cultural activities such as theater, museum, and concert. As we've seen with the COVID restriction are going to be less present, we suggest that maybe you go and enjoy a movie or go around some concert. And we suggest that you always practice social activities. So I'm sorry for the noise. So Marie-Christine, I'm gonna leave you to answer.
Do you have visit? I'm joking. It's okay. Thank you, Sarah, for all those tips. I know it's easier to say it than to do it, but of course, in everyday life, we sometimes forget to take care of ourselves, and it's important that we take care of our overall health throughout our life. So make sure you are as healthy as possible. I think this is something that that comes out of all the tips that that Sarah just has mentioned. And by taking control of your health, you will be able to discuss your concern also with your doctor and quickly manage a neurocognitive disorder as needed. So visit your doctor regularly for checkups, monitor your health, and this also includes eye, hearing exams, because those difficulty can cause some stress and confusion and can mimic some of the symptoms that I mentioned before. People also with it's important to know that people with a neurocognitive disorder can live meaningful and productive lives for many years after an early diagnosis. Neurocognitive disorder diagnosed early helps both the person and the family members to learn about the disease, set realistic expectation, and plan for their future together. There are many benefits of an early diagnosis, but I'm here to tell you about our top 10, top 10 of the reasons. So getting an accurate diagnosis, because conditions such as depression, thyroid disease, infection, or drug interaction sometimes produce symptoms similar to those of neurocognitive disorder. Medical assessment can lead to an accurate diagnosis so that appropriate treatment can begin. Being actively involved in healthcare and personal decisions. So earlier in the process, the person is able to participate more actively in their own healthcare decision and future plans. Using medication effectively. So treatments for Alzheimer's disease and other neurocognitive disorder is typically most effective when started early in the disease process. Focusing on what's important. So an early diagnosis allows the person to set priorities based on what is important to them, such as traveling, pursuing new goals, or deciding when to stop working, for example. Making choices is empowering. That's a hard word. Empowering. Which allows the person with neurocognitive disorder to make informed decisions about legal, financial, or care matters and make their wishes known to their family and friends. An early diagnosis can help take advantage of resources, so the person and their family can benefit from local Alzheimer Society information, support, our education program to learn how to live well with their diagnosis. Supporting families who understand the disease and the challenges that comes with its progression are better able to support the person with Alzheimer's disease and get the help that's right for them. Another benefit is advocating. So people with Alzheimer can make their voices heard to raise awareness about the disease, the need for quality care, and increased funding for research. Those types of diagnosis can help advance research because people can participate in clinical trials or other research to help improve diagnosis and enhance care. And finally, reducing stigma. So people with neurocognitive disorder can continue to live life to the fullest, sharing experiences of living with Alzheimer's disease or another type of diagnosis can be very helpful to reduce stigma of the disease and in encouraging others to reach out for support. So this concludes our presentation for now, but I'm going to take a few minutes just to talk about the Alzheimer Society of Montreal, where our mission is to alleviate social and personal consequences of Alzheimer's disease through the development and delivery of leading edge intervention, care, and support services. Our person-centered care is a philosophy that recognizes each person as a unique personal history, personality, and values, and that each person has the same right to dignity, respect, and the privilege of participating fully in the life of their environment. So at the Alzheimer Society, we really promote a person-centered approach to care, and this person aims to maintain the person's individual identity despite the impairment of mental faculties. So we have a lot of different services for people with Alzheimer's disease, their caregivers, professionals, and organization. We have personalized and adapted services for people with Alzheimer's disease, such as individual consultation, art therapy, activity centers, in-home respite and stimulation programs. For family caregivers or care partners, we can allow them to have a respite for a day, for a couple of hours a day. We have our therapy groups also for caregivers, and we have support and information, individual consultation, monthly groups, monthly support groups, or information group. We have services that meet both the needs of caregiver and the person they're helping by spending quality time together. For example, we have visit to the museum, we have therapeutic groups such as laughter yoga, creative dance, tales and travels, other types of leisure are therapeutic groups, therapeutic activities. We also offer quality training to healthcare professionals and organization. And we, of course, offer some conference and information to general public, such as what we're doing today. And so that's it for the Alzheimer Society of Montreal. That's a really quick overview of all that we're doing. So